The aged care workforce stretched to capacity. A solution to help maintain continuity of care. It could provide employment for thousands who have lost their jobs. This is a special Altura Now with Nicola Burton.
Thanks for joining us. The aged care workforce has been stretched to capacity for several years. It's becoming harder to recruit and retain skilled staff, and the COVID-19 pandemic is putting additional strain on our current workforce and aged care providers. Altura Learning is proud to have partnered with aged care recruitment company Dash Group and the peak body Leading Age Services Australia to bring you an innovative workforce solution. We've created a new role designed to support your current workforce during the pandemic. Through consultation with employee and employer groups, we've identified what support your staff need at this time, and we've created a temporary role called the Aged Care Assistant. Joining me to discuss this workforce solution is Sarah Buckley from Dash Group and Sean Rooney from Leading Age Services Australia. Thanks so much for joining us.
Great to be here.
Great to be here as well.
Sean, can you please explain the impetus behind the creation of this role?
Yeah, thanks, Nicola. I mean, this program's a win-win because it helps guarantee a good quality care for older people at a very challenging time, whilst also providing employment opportunities for individuals that have been lost their current roles in other sectors, such as hospitality, airlines and tourism and the like. Now, our workforce is already being impacted by COVID-19. We know that across the country, people are having to self-isolate either through the risk factors or being symptomatic. And so we need to prepare for the best way to be able to accommodate those absences. And the way to do that is through coming up with this new aged care assistant role, which will complement and support the existing workforce to ensure that we continue to deliver, high standards of good quality care for older people.
Sean, can you explain what the aged care assistant will do?
Yeah, look, this new role is really clearly defined. This is looking at delivering the basic care needs for older Australians in residential care. So this is about assistance with meal distribution and preparation, as well as assistance with mobilising care recipients, so using wheelchairs and the likes. Non-intimate hygiene, so brushing of teeth and hair, ensuring social assistance and companionship around recreational activities and the like, assistance with bed making, distribution of clean linen, etc., and then just other general administrative tasks. It's important to note here that this is not replacing existing staff, but this acts as a support for the staff, and the role has been designed to work under the supervision of current staff. So this is a backup to complement the passionate, professional, dedicated people in our sector today.
And Sarah, you've joined our partnership to recruit staff in the role. Can you explain the process to me?
Yeah, so what will happen is we will work with the organisations and the candidates to create a match between the two. So we will source the candidates, we will screen them. That process will be quite thorough. We'll include personality testing just to ensure they have the type of personality that can work, within an aged care facility, and support the staff that are obviously already working there. What we'll also be doing is obviously Zoom video screening, really getting to know the candidates before they're actually introduced to the organisations that choose to become part of the programme. What we're really mindful of is obviously the risks to the residents of incomers to the facility. So one of the big things that we'll be looking at is ensuring their flu vaccines are up to date, making sure they've not been exposed to anybody, obviously, that has been diagnosed with COVID-19. This will be in the form of waivers that we will issue, and obviously they will be encouraged to isolate for as long as possible prior to actually taking the role.
And Sarah, you do their police check as well, don't you?
We do indeed, yes. So that is something we will be asking for upon initial application. If that isn't current, we will be ensuring that gets completed before obviously they commence that role. So following our screening process, what will then happen is they will be passed over to Altura Learning. They'll complete that process, and that's when the onboarding process within the organisation will start.
And we've actually been inundated by employers already looking to employ this role, haven't we?
We have indeed. So we've had a number of responses from various types of organisations across Australia that really want to get involved with the programme. And then in turn, obviously, we've had a fantastic response from the candidate side. So obviously, we really want to get this moving and just ensure that, we can get the placement started as soon as we can.
At Altura, look, we're really conscious that aged care organisations are already resourced to capacity during this time. So we've tried to reduce the training burden on organisations as much as possible. We've designed a comprehensive 10-hour online training program, and it has two components. The first part is aged care preparedness, which covers the mandatory type training that would be completed normally during orientation. The second part is role preparedness, so candidates have the necessary knowledge to undertake their role. We've also created a range of workplace support documents to support organisations to orientate the staff that Sarah is screening to ensure that they can fulfil the role that's required while still maintaining the standard of high quality and safe care that you already have in your organisation. Now, Sarah, there's two employment options for employers to choose from. Can you explain those two models?
Yeah, of course. So we'll be looking at two models. So the first model will be organisationally employed. So that means that the provider will pay a one-off flat fee to us. They'll be provided with an individual that's been thoroughly screened, has gone through all of the processes that I outlined earlier, but they will just pay that fee and they will directly employ them. So they will handle all performance issues, etc. And the other option is a much easier option in the sense that we employ them. So we have current labour hire licences across Australia. So for an hourly rate that the provider will pay to us, we will provide that individual with all of the same screening, the Altura Learning training, and they would obviously be employed by us at Dash Group. So they would have obviously timesheets to complete and all of the process that you would normally follow with the organisation, but it just ensures that we provide all of the insurances and all of the support as well to the employee.
And Sean, what impact do you think this role will have on aged care organisations?
Look, I think it'll have a tremendously positive impact on organisations providing residential care for older Australians. In a time of significant challenge and uncertainty, what this does is give those organisations confidence and assurance that there is available to them skilled, trained, quality workforce out there to support them doing what they need to do to protect vulnerable older Australians. And in particular, it'll allow those organisations to have their existing workforce well-trained to focus on delivering the care they need to do. It'll actually support the continuity of care and service of the utmost quality. It'll support the existing staff with respect to feelings of being overwhelmed and burning out. And then it also gives access to those providers access to a surge workforce capacity and when it's required. So I think it'll be fantastic support for our sector.
And Sean, this program has the benefit of supporting people who are displaced from other sectors. So we're talking about people who are currently unemployed or stood down from industries such as aviation or hospitality. Can you tell me a little bit more about that?
Well, look, I think that's where the win-win comes in here, because we know that those people have been displaced from their normal workplaces and sectors that they work in. But these are very well-trained individuals. They have a service ethic. They are customer-focused. And, if we can support them to come in and help care for vulnerable older Australians at risk of COVID-19, then I think it's a great service to older Australians and also a great service for those people displaced from other sectors.
And of course, we're encouraging students who are completing their Cert 3 or Cert 4 to apply as well.
That's right. We would certainly encourage anybody who's currently studying to participate in this program. And look, we know that we need to grow our workforce over the coming years in order to meet the demand that's coming with respect to the growing numbers of older Australians. I think this is a tremendous opportunity for the sector. to allow people that would otherwise not have the experience of serving older Australians and making a meaningful difference in their lives. And so this is a great opportunity for other people to come and experience that, and hopefully they decide that they want to continue in that noble cause of looking after valuable older people in this country.
And Sarah, say if there was a person who's undertaking the role of the aged care assistant and wants to continue working in aged care, such as Sean mentioned, what do you suggest that they do?
I would definitely recommend, they look into uptaking the Cert 3. Also, what I can do from my side is I work with various different clients, recruiting carer roles, catering assistant roles, all roles related to where they might assist. So it's definitely something that we will fully support with any of the aged care assistants that we recruit during the process.
Sean, have you got anything else you'd like to add?
Yeah, thanks, Nicola. Let me just give a heartfelt shout out to all the passionate professional workers in aged care across Australia today. You are doing an outstanding job in very, very difficult circumstances, and we know at time with limited resources. And the work you are doing is saving lives and protecting vulnerable older Australians from this unprecedented pandemic. And I just want to say, on behalf of our organisation and on behalf of the country, you are to be praised for your efforts. So please, please keep up the great work that you're doing.
Completely agreeing, Sean. Thanks so much for sharing that. Sarah, Sean, thanks so much for joining us today.
Thank you.
My pleasure.
We anticipate this program will be incredibly useful for aged care organisations, and we really look forward to hearing the feedback from people who've used the program. For additional information on the aged care assistant role, or to register as an employer or a candidate, the web address is on your screen now. I'm Nicola Burton. Join us next time on Altura Now.